looks like there's lots of peoples out there, eh? Well, pitter patter, let's get at her.
Today we're going to be talking about triage in a multi-casualty incident or in general in what we use it for. Looking at the multi-casualty incident aspect of it, the reason that we triage is to provide the greatest amount of care to the greatest number of people. The needs of the many outweigh the needs of the few or the one. START is a widely accepted system used all over the world, and it's used right here in our agency. The first thing you do is determine green patients. How do you do that? Who is walking wounded? On your arrival, make a loud announcement and tell everyone who can, come over this way, and give them a place to go. Everyone that walks over there, regardless of their injury, is now triaged green. They are walking wounded.
If you can hear the sound of my voice, I need you to move over to the fire truck.
At this point, you then have to go into the debris field and start assessing your patients. I see hurt people. Walking out into the debris field and begin assessing these patients. As you're approaching them, you're looking, are they breathing? If they are breathing greater than 30 times a minute, well, they're going to be red tagged. They're hyperventilating. If they are ineffective breathing or not breathing, we attempt to reposition the airway. If they don't begin breathing on their own, they're black tagged. Are they breathing? Next, we're going to assess their perfusion. We're going to reach down, we're going to feel for a pulse. If they're breathing normal, but don't have a radial pulse, they're red tagged, and we move to the next patient. If they do have a radial pulse, then we need to assess their mental status. This is what I've trained for my entire life. Assessing mental status by asking a simple question that they could provide an answer to. If they can answer that question, but they are unable to walk, they're yellow. If they are altered, then they're red tagged. 10-second triage. Class takes about 4 minutes, but it's 10 seconds in triage. It begins when you lay eyes on your first patient. As you are approaching them, you have 5 to 6 seconds to categorize their breathing status. Are they breathing? If they're not breathing, they're black tagged. As you're approaching them, that's one breath. Now you begin to count. 1001, 1002, 1003, 1004, 1005, 1006. In those 6 seconds, you can determine their breathing rate. If they are breathing one breath every 60 seconds, 'tis bad. If they're breathing one breath every 2 seconds, they're breathing too fast. That's greater than 30 times a minute. If they are breathing every 3 seconds, that's 20 times a minute. That's acceptable. 4 is 15 times per minute, and 5 seconds between breaths is 12 times a minute. Those are acceptable rates. Not breathing, breathing too fast, breathing acceptably. You can determine that as you are approaching your patient. As you are laying eyes on them, watch their breathing. I encourage you to do that in Walmart. Do it every day. Do it everywhere you go. Just watch people breathe. How fast are they breathing? Next, as you are determining their breathing, if they're red tagged, they get a red tag and you go to the next patient. If they're breathing acceptably, you're going to reach down and you're going to feel for that radial pulse. What does that radial pulse tell you? It tells you that if they have a sustainable blood pressure. If they don't have a radial pulse, they get a red tag, and you go to the next patient. If they do have a radial pulse, you need to assess their mental acuity. Ask them a simple question. Everybody says alert, oriented. No. Ask them a simple question. Why didn't you get up and move? If they can say, because I'm stuck to the ground in my liver, they're alert and oriented. They get a yellow tag. If they can't answer you, they're red tagged. They're altered. Tag them and move to the next patient. 10 seconds, all it takes. On approach, feel for a pulse. They have a pulse. Why didn't you move? With that answer, you tag them, you move to the next patient. It's rapid, it's simple, it's 10 seconds. The only difference with pediatrics in the jumpstart system is 5 rescue breaths. When you open their airway, if they begin breathing on their own, they're red tagged. If they don't, you give them 5 rescue breaths. If they begin breathing on their own, they are red tagged. If you do not begin breathing on their own, they're black tagged. There's patients all over the place. After you have triaged and tagged these patients, you go back to command and you give them the number of patients, the color of those patients, and you determine what resources we need to call in and what your next step needs to be.
I say, Petunia, there are people out there harmed. Oh, tally-ho then.
The biggest difference between you and the victim is the manner with which you approach the scene. In The Guardian, Kevin Costner, talking about rescue swimmers, identifies that same notion. The biggest difference between the rescuer and the victim is the attitude with which they enter the water. The biggest difference in outcome, in success of that scene, is going to be how do you approach this scene? How do you approach this incident? Help. There's too many people. Help. Triage is the sorting. Get in, get them triaged, get that number. Treatment will come, but figure out what you got first. That's where it starts. Approach the scene, make your triage, make your decisions, then begin your treatment. That's the way for a good, successful mission. Thank you for watching today's class. If you liked it, hit that thumbs up button. If you want to see more, hit that subscribe button. There's going to be more coming out soon. And thank you for stopping by. Have a good morning.
Meow.